So the Affordable Health Care Act, or Obamacare, remains to this day perhaps President Obama's most controversial achievement. So, plan to discuss your thoughts on the law and on the constitutional position written in this summer.
Sure. Yeah. All right. Well, I can tell you that for young people, I think Obamacare is a big deal. I think it's a very big deal. And I guess I'll start out, since we are all in college here, by stating that one of the most popular parts of the law that really inspired me in the first place is that young people can stay on their parents' health insurance until they're 26. I think that is a great achievement, and it's a great part of the law. But I think, look, what the president did with this law is he kind of looked at our health system and saw kind of the taking over of the health system by the insurance companies. And that was in various ways. It was denying people with pre-existing conditions. It was charging women more for the same healthcare coverage. Charging them more for the same coverage, giving them higher costs. So essentially being a woman was a pre-existing condition. It was putting lifetime caps on insurance coverage. All of those things. So what the president did is fundamentally, what he did was he did the right thing, and he made it so that people can no longer be denied coverage, so that the number of uninsured people is going to be virtually zero, that millions of more Americans are insured. And he did so in a way that is paid for by, there's about 1% of the population. I think people have this misconception of law that the government is forcing you to buy some sort of new health insurance. There's the whole death panel thing. For everyone in the country, if you have an HMO and a doctor that you're happy with, nothing changes for you. The only thing that changes is that people, about 1% of the population who can afford to buy health insurance but chooses not to and uses the emergency room as their primary care, they now have to pay for the costs they incur when they go to the emergency room. And that's the only part that the mandate covers, and that's how the law is paid for. But I think what this really does is it makes it so that our system is fair, our system doesn't deny people, we have a more humane healthcare system, and we have a system whereby young people can stay on their parents' plans, and I just that's one of the reasons I supported it in the first place.
Yes, I like that.
Who's for Life is against the Obamacare specifically because it violates conscience, not just religious conscience, but those who are atheists or agnostic even and are pro-life, because I do believe, and Who's for Life believes, that you can separate the pro-life issue from religion and still have a very sound basis. In addition, I'd just like to point out that there are over 7,000 federally qualified health care centers around the country to serve underprivileged and underinsured families that also supply free screenings for women. So cutting the federal subsidies to Planned Parenthood and the like would not deny these underprivileged families or women that access.
The Feminist Legal Forum strongly supports the Affordable Care Act, as well as the Supreme Court decision this summer, which upheld the act. And the reasons are twofold. The first is that the Affordable Care Act now prevents discrimination against women. And the second is that the Affordable Care Act requires insurance companies to provide women certain health care prevention services at no cost. Now, as to the first, the Affordable Care Act will ban abusive insurance company practices, and it will no longer be the case that simply being a woman, being pregnant, or being a victim of domestic violence is a pre-existing condition that precludes you from being covered by insurance. Now, these protections are fundamental to furthering women's equal access to education and jobs, like we talked about earlier. Now, the second reason why the Feminist Legal Forum strongly supports the Affordable Care Act is that it requires insurance companies to provide certain prevention services at no cost to a woman. These include annual well visits for women, screening for gestational diabetes, screening and counseling for domestic violence, contraception, breastfeeding, counseling and supplies, including access to the morning after pill, HPV testing, and counseling for sexually transmitted diseases and HIV. And all of these services being provided free of charge to a woman are huge. This is monumental, this is historic, and this is a great move in the area of women's rights.
Yeah, I mean, I think a lot of the things that the healthcare law is trying to do, bringing healthcare to a lot of people, is really good. But I don't think that you can reasonably expect the institutions of the healthcare bill to be able to deliver those types of things. If you look at other countries, Canada, for example, you have to wait months to go and visit your doctor, and you have to be put on lists and to get certain operations. And I think that that there are significant problems with socializing healthcare. But what I'd like to focus on today is an argument that's not often brought up, just because I'm sure that everyone has heard this debate more than enough times to kind of have their opinion made up. But I think that what's important to remember about the healthcare law is that some of the strongest supporters of the Affordable Care Act were health insurance providers. Why would that be? Why would health insurance providers want to get forced into providing all of this extra care to all of these people? It doesn't make any sense. If the insurance providers and the healthcare providers are all being bad and not giving you what you need, then why is it that they're all supporting this bill? It's because they want to expand their market share. This is just a way for them to make money. Do you think that the Affordable Care Act is going to improve your care because and get away from these corporations that are being evil? Then why are the evil corporations supporting the bill? I think that if you follow that train of thought, you will see that the Affordable Care Act is nothing more than a scheme to get a guaranteed market share and make more money for these same insurance companies.
Yeah, I would just echo a lot of what Dylan was just saying, as well as what Christine was saying earlier. But I want to touch on a few different things. First of all, Alex, you brought up the point that under Obamacare, young Americans do get to stay on their family's insurance plans. Now, I'm not sure if you're aware of this, but when that bill was first introduced, that was not in there. That's a Republican idea that was introduced by Republicans into Congress. It was then incorporated into the final bill. So I commend you on supporting a Republican idea, so thank you. Secondly, I think it's important that we also look at how this bill was originally introduced by the Obama administration, and it was introduced as a single-payer system. I think that's a very key thing to note here, in that, for this election at least, it's pretty clear that Obama supports a single-payer system. Whether or not the bill was actually passed, I think it's pretty clear that that's what he supports. Secondly, or thirdly, I'd also like to point out that 95% of small businesses in America have said that under Obamacare, it will discourage them from hiring new employees. 95%. I could be slightly off my statistic, but it's above 90. I know that. And I do know that 95% of Americans are hired by small businesses. So what does that mean? That means that this Obamacare and this bill and this administration are directly stunting job growth in America. Second, fourth, whatever number I'm like, I want to comment on the Supreme Court's ruling. We do support the Supreme Court and the decisions that they bring down. But I think there's an important point to make here, and that is that the Supreme Court found that it was constitutional because now Congress has the right to tax Americans. So basically, what the Supreme Court was saying is that this bill taxes middle-class Americans. Is that what we need in the middle of an economic recession? Is more taxes, more taxes? No, that's the last thing you want in the middle of an economic recession. And so for that reason, Governor Romney and Paul Ryan do support repealing Obamacare on day one. As soon as he goes into office, that will be his first actions to repeal Obamacare. And secondly, I think, like Dylan was saying, this is an example where the federal government simply should not be stepping in the middle of the patient and the doctor. The federal government needs to stay out of it.
I'd like to follow up first with Mr. President. So you talk about a lot of the good Obamacare, but and you alluded to earlier in the debate how when he entered office, the number one thing that was on President Obama's mind was kind of the economic crisis and the recession, the longest high unemployment rate that we've had since the Great Depression. Should President Obama have spent so much of his political capital and so much energy on passing Obamacare in view of those circumstances?
Yeah, a lot of people ask me that, and I think one important thing to realize is with the practices that the insurance companies were doing is, given the high cost of healthcare in this country, some people, when the economy tanked, they had to choose between their home and their healthcare. That's how bad it was. And so, people were facing a situation where you either had to choose whether you were uninsured or you were going to pay your mortgage. And so what he did, I believe helped a lot of middle-class Americans. And a lot of middle-class Americans have a family member with a pre-existing condition, and consequently they can't get covered. And so that raises the rates for the entire system. When people who are uninsured raise the rates. And it's not about demonizing people who are uninsured. It's about getting them covered so that when you broaden the base, the healthcare rates go down for everyone. More people are paying into the system, so the rates, the more, it's like car insurance. I mean, the more people you have paying into the system, the lower the rates are going to be. And so that's, I think, what was the premise behind the president's healthcare bill.
And Ms. Robbins, with your expertise as a law student, and Ms. Hafford kind of alluded to this, I was wondering your opinion on the kind of what has been termed the contraceptive mandate by the media and the religious associations that are now currently suing the administration over the issue. What is your stance on it?
So the feminist position on the issue of the contraceptive mandate is that it doesn't prevent anyone from exercising their religion. If it's your religion not to have an abortion, that prevents you from having an abortion or from using contraceptive services, then you're free to exercise that option. But it's not okay for you to impose those views on other people by preventing their access to abortion and contraceptives. Now, I'd like to address my colleague Matt, who stated the Romney position so nicely, and he said at the end of his statement that this isn't a place where the government should come between a doctor and his patient. And I think it's an interesting juxtaposition that the Affordable Care Act isn't the place for a doctor and his patient, isn't the place for the government to come between that relationship. And yet, it is the Republican position that the government should have a place at the table when a doctor and his patient are discussing whether or not it's right for her to have an abortion.
Ms. Hafford?
I would respond that, in fact, our money is going to a cause that Who's for Life, the pro-life stance, does oppose. And in that respect, it does violate our right to conscience. At this point in time, you are free to get an abortion, and if Romney's plan were pursued and it were to return to the state level and a state allowed abortion, that would not prevent a woman from obtaining an abortion just because tax dollars are not funding her.
And Mr. Warren, just kind of specific, you emphasize the fact that the Romney Ryan ticket would repeal Obamacare on day one. How do you propose that they do that without a supermajority?
Sure. A number of the proponents that are within the Affordable Care Act can be done within the administration through executive order, as well as just the overall policy of the administration. Certainly, the brunt of it would need to be done through congressional action. Keep in mind, though, however, that the president, or at least the president's supposed to be, the one who submits a budget to Congress. And so it could very well be defunded through that measure in Governor Romney's budget if he were elected president, that program would not be funded. Again, and I say supposed to be because obviously President Obama hasn't submitted a budget in 4 years. But, I do want to address Ms. Dobbins' point earlier. I just want to emphasize, the abortion issue. I hate to go back to it because, again, I don't think this is a major issue of this campaign, but or this election. But I think the abortion issue is a religious freedom issue and not necessarily